Hi, my name is Shrey Harti, and I am a life coach. I have various degrees in psychology and a certification in coaching from the University of Miami. Uh, I started this channel today, obviously, because I feel that there is a significant need out there to help people get through their daily lives. Um, I started studying psych back in 1998, and I have been pretty much studying it ever since. I have over 1,000 hours of mental health counseling experience, and I have thousands of more to get in training. I am also certified, like I said, as a life coach from UM, and for me, it was very, very important that in this first video I discuss with you the differences between, excuse me, the differences between the two professions, I guess. Um, Trained as a mental health counselor, it is very important for people to understand that there is a difference in the two processes. That many people are going around today and they're saying things like, um, oh, I'm a life coach, or I'm this kind of coach, I'm an executive coach, I'm a, they're life gurus everywhere. Um, but really the question comes down to, what are their qualifications? One of the things that was really important to me was that I got extremely clear on what it meant to be a life coach as opposed to a psychotherapist or a mental health counselor or a psychologist or a psychiatrist. Not just for me, but for consumers, for clients, or for patients. Um, in the different fields, different practitioners have different titles. Some people call the people who they see clients, which is more like a life coach have a client. Psychotherapists, mental health counselors, people with master's level training, which is what I have. I have master's level training in mental health counseling and psychological studies, and tend to call it depends on where they're working. Sometimes if they're working in a hospital, they'll refer to the people who they're working with as patients, because technically in a hospital setting, that's what they are. A lot of times, uh, you know, in the social work setting or in group home settings or whatever, wherever it is they practice, they refer to the person who's coming to see them or whom they're going to see as a client. Okay? So, client and patient, those are two things that are very significant as far as the perspective of the practitioner on who it is they're working with. And also, um, especially when it comes to coaching as opposed to therapy or psychotherapy, it is significant not only in the process, but it's important to understand that there are different ethics that go along with the practicing of either profession. There's ethics and there's laws and there's boundaries, and people who are going around and saying, "Oh, I'm a counselor," or "I'm a therapist," "I'm this." It's very important that when you are choosing your mental health professional and or life coach, and I like to separate the two, that you are aware of their training, their education, okay, their experience, and their knowledge of laws and ethics. Because essentially, you're putting your life or your goals, your future, um, regardless of how big or how small the details are of what it is you're trying to achieve in your sessions, you're putting those end results in the hands of that person who claims that they are A, B, C, or D. So be an educated consumer. Now, for me personally, getting started as a mental health counselor or a psychotherapist, whatever you'd like to refer to me as, um, it was 2 years, well, 4 years of undergrad in psychological studies and psychology, and 2 years master's level program, complete with 1,000 hours or more of internship under the supervision of a licensed practitioner. I practiced in several settings. Um, Substance abuse was one of the things I came across, and I worked with kids in various settings. Um, and obviously adults, their parents, and things such as that. But having a background in psychology, and they make it very, very clear that certain people can call themselves psychologists, which are people who have, you know, tends to be between 3 to 5 years of training in a PhD or a PsyD program, which covers a lot of the same things as mental health programs, social work programs, and but clinical practice and counseling practice, along with all the education, the practice, the internships, the time in with the clients, the supervision, and in those arenas, they very much so stress the importance of ethics and laws. Can't have certain relationships as a psychologist or a psychotherapist or a mental health counselor with your clients. In general, you're supposed to be a clean slate for the most part, and you are not supposed to have personal relationships with your client or patient. So, psychologist, 4 years, PhD or PsyD. Some people have EDDs, and then mental health counselors or social workers tend to have MSWs, master's level social work, um, or mental health counseling degrees, MAs, MSs, Masters in Science in Psychological Studies, and psychiatrists. People get confused between psychologists and psychiatrists all the time. Psychiatrists are actually people who go to medical school, become actual doctors, medical doctors, MDs, medical doctors, or osteopathic medicine medical doctors, which are DOs, and they get to write prescriptions because they've studied the human body, and then they go on to residency programs where they train in therapeutic practices, diagnosis, and treatment. Okay, diagnosis and treatment is also something that's very significant and unique to the mental health practitioners. Mental health practitioners, psychotherapists, mental health counselors, psychologists, psychiatrists. Diagnosis and treatment. So they come from a medical model. In coaching, we do not practice from a medical model or a medical standpoint. We do not have medical training, okay? Some people, some doctors may become health coaches, wellness coaches, along as part of their practice. And so identifying what people's educational background, training, certifications, licenses, all of those things, for the consumer, that's very important to identify what it is the person has that qualifies them to practice whatever process they're practicing with you. As far as the things that I just wanted to go over in this first video, I wanted to make it clear just the amount of study and the sort of things that people actually study in psychotherapy. But I don't even know what I don't know what the length is of a video that you can have on YouTube. So I guess what is important to say is that for mental health practitioners, they practice out of the DSM, either 4 or 5, depending on what's available, what's most recent. And that basically, like I said, it has in it diagnosis and let me just cut this.